At this time, I'd like to invite Wendy Hart, President of the American Friends of Jamaica, to come on up and make a few remarks. So you got to clap up Wendy Hart, because thanks to the American Friends of Jamaica, we have butterfly, IQ probes, and iPads. So clap.
Thank you. Thank you. I'm really happy to be here today, and thank you so much to Minister Tufton and to Minister Cuthbert-Flynn for not only for attending, but really for leading on this initiative. So today for me feels like a very big day. Not just because of the incredible work that will be happening with our volunteer doctors from Jacobi, NYU Langone, led by Dr. Dixon and Dr. Clooney, along with the doctors from 11 hospitals across Jamaica. Because today is the start of something bigger. Today is an example of how ideas can germinate and develop and come together for a bigger initiative. We've started this story before, but I still think it bears some retelling. So I think we said it was in March, in March the 1st. I had a very good friend who was the chief medical officer at Butterfly, and we were talking about how it could really have potential for use in global health and in Jamaica. And one day she called me, I think Trevor was actually in her office, and she said, "Do you know Dr. Trevor Dixon from JAHJAH Foundation?" And I said, "You know, I know JAHJAH Foundation, but we've never met. Like, we're working parallel in healthcare, but we've never actually met." And so she set up this call with both of us to see where it could go. And as Dr. Dixon said, they were working on a pilot project for Black River. And we started to talk about how we could make that something bigger. And that was the launch of JAHJAH. And then simultaneously, Karan Chung, our executive director, was working very closely with Minister Cuthbert-Flynn and with Dr. Ennis on a maternal health initiative. And then we came together and we said, how can we make this something bigger? Because I think actually in the beginning, these handheld devices didn't even work for OB, right? I think it was stage 2 when it got to IQ+. So we were like, wow, they can now work for OB. This is going to be really incredible. And this is really the place where AFJ likes to do its work the best. When we know we can be involved with a grant of impact and transformation and change. And I really thank all the medical professionals in this space today, both who are training and who are going to be taking this out and, as Dr. Dixon said, become the super users and trainers themselves. Because certainly on the launch of JAHJAH, the team from Jacobi and all of the doctors, Dr. Wong will call you out, but it was Dr. French, it was a team of 10 or 11 people who met, who talked about whether the handhelds were the right thing for us to use, which manufacturer we should use. It was a long time getting to where we are here today. So thank you so much. And I'd like to thank, partnerships are really what get things done. So to the Ministry of Health and Wellness, JAHJAH Foundation, the doctors, and as we said, always the donors. Because sometimes people look at our foundations and they think, oh, this foundation gave. But really, we don't have any big, we're not like Gates Foundation with $1 billion sitting down and we have money just to decide what to do. No. The only way that we get our work done is that every year donors give us money, and every year we give out all of that money, and then we start again. Yeah, we have a gala in Miami on March 11th, one of our fundraisers, if anyone would like to be there. So some at Bailey Healthcare, Ralph and Ricky Lauren Foundation, the Bluefields Villa Foundation, they were our major donors. But as Dr. Laura Tanner, who's one of our directors, said, we also at our gala raised funds, so there were many donors who gave $100 towards helping us get one of these devices. So today is the start, and as we've mentioned, we hope that we will actually move on to phase 2. Our goal is to have these handheld devices in as many doctors' pockets as possible. One of the things that we will be very actively involved in is monitoring and reporting back on their continued use. Quite honestly, we've been reaching out to many doctors in the US, and one of the things that they're worried about is are they going to stay in the hospital because they are so portable. But you know, we really believe in transformation and care, and we think that what we'll be back for next time is phase 2. Thanks.
Keep the applause going. Thank you so much, Wendy. Thank you very much.